What makes an exercise really, really valuable is if it's firstly well planned and thought through, but then if the results of that exercise are thought about and then changes that are suggested by what we learn are actually implemented.
Most of us don't respond well if we face something that's rare and catastrophic. It's almost like inoculating them. Exercises are a form of inoculation for emergencies. You start to bring together people that need to respond to the crisis, but they've never met each other before. They don't usually work with each other. And people from different departments getting to know each other and learning to cooperate really helped.
So different sorts of exercises that I've participated in have included all government agencies here in Australia working together to work through the consequences of pandemic. I've participated in several of those.
The value comes in not only the learning, but the interaction that you have with others.
This exercise was particularly valuable because it catalyzed, or it brought together the essence of what can we do to be prepared for a situation that is per definition unpredictable.
That interactive experience in working with people who can contribute and who can add new perspectives is something that I think is of great value.
I'd like to sort of perhaps highlight 5 factors that will, let's say, need to be considered before you can achieve that aspirational goal. The first factor is, I think one needs to be aware of the context. The second point is coordination or lack of coordination. The third issue, which is related to that, is leadership. In my experience, it is so important to have strong political will and commitment. The fourth factor, which I think is particularly important here, is credibility. Okay, you talk about tabletop exercises. Okay, who actually owns the exercise? They want tabletop exercises which are relevant to the local context. The fifth factor is just to highlight that in many developing countries, the concept and the idea of a tabletop exercise is not so commonly understood.
You need exercises at different levels of resource intensity, and you also need to be able to spread it out because, for the small group of people, the 20 or 30 people involved in an exercise, it's real for them. If you have a really good exercise, it has to be technically sound. It has to be, a well thought out scenario.
If the participants are active in their respective roles, it also provides a networking and just getting to know opportunity for the participants. It's already hard to pick up your phone and call someone in peacetime. In a stress situation, it is really, really nice, and you fall back on people who you have had interactions in the past.
It's one thing to read something. It's one thing to witness something. It's another thing altogether to be engaged in something.
We know there is no substitute for having practiced everything from fire drills through to what happens if we need significant health resources deployed to an accident or an event of that kind. So we need both sorts of exercises, but thinking about what's timely, what's relevant is really important.
So the value of an exercise is that it uncovers blind spots, things that you hadn't considered before, and it raises awareness, not just in the staff that are involved in the exercise, but also in the policymakers and the decision makers as to the types of resources and coordination and decision making that has to happen.
The kinds of people who should be involved in exercises don't just include health professionals. These events include transport workers, they include people working in production, factories, they include government workers in treasuries, all across all parts of our society. So thinking about the breadth of people who will have to respond and making sure that representatives of those groups participate, I think means that we can be much better prepared.
It's much harder in a resource dependent environment But at the same time, it's especially important in those environments.
And when you sort of push it up to the level of the policymakers and decision makers, it makes the crisis real to them as well. And it helps them then free up the resources that are needed for these kinds of responses.
There's no doubt that previous exercises did give us some level of preparation for this pandemic.
To the extent we're able to make some recommendations based on that experience. And those recommendations could become the basis for either new regulation, new public policy and legislation, new statutes that could be developed, and certainly a far more effective effort to plan for the next challenges as they present themselves.
So you may need a certain amount of awareness raising, even education, maybe cite examples of tabletop exercises that have been done in developing countries, not just in health, but in other areas. What I would hate to see is for the tabletop exercise to remain on a tabletop.
So for all countries, regardless of income, regardless of geography, these sorts of exercises can really be beneficial. And it can be sometimes difficult for them to be organised. People are busy, they cost money, but I think it's worth thinking about as a collective, as the world, how it is we help people do this kind of work.
And this is the right time to do it, because it's not a question of if, it's a question of when the next pandemic will hit.